Life is good here in the Lowcountry, and one medical provider is working very hard to make sure that it stays that way. St. Joseph's Candler has been providing advanced medical care to citizens of the Lowcountry for decades. Known for their highly skilled medical personnel, their commitment to breakthrough treatments and state-of-the-art technology, St. Joseph's Candler offers a wide variety of programs and services to treat illness and promote wellness to all of the citizens of all of the communities it serves. Today, we're taking an inside look of one of the many ways that St. Joseph's Candler is improving the health and well-being of the region. This is Living Smart in the Lowcountry. Thanks for joining us. Today we're taking an inside look at just one of the many medical services offered here at St. Joseph's Candler's Bluffton campus. This new medical campus is home to numerous medical disciplines and serves as a satellite location for the nationally recognized Nancy N. and J.C. Lewis Cancer and Research Pavilion. Today, we're looking at radiation oncology, some incredible state-of-the-art technology offered right here in Bluffton, some of the latest and greatest treatment strategies, and how together these create more positive patient outcomes. Let's get started. You're watching Living Smart in the Lowcountry, and we have a lot to discuss today. First up on the docket, we've got Dr. Stephen Ramey and Dr. John Michael, who's going to talk to us about some of the treatments and some things that we look forward to here at St. Joseph's Candler. Thanks so much for doing this.
Yeah, thanks for having us.
Absolutely.
Yeah, thank you.
I know it's a busy schedule, and we're glad to get a moment to sit down and really talk through some of this so that our viewers can understand what's happening here. We're going to talk about radiation oncology to begin. So let's talk about how that's different from other oncology treatments.
Yeah, so the three kind of main branches of oncology treatment are surgical oncology, kind of medical oncology, and radiation oncology. And so, most people pretty much understand surgical oncology. You go in, you have a surgery, usually to take a tumor out, something like that. Medical oncology typically involves treatments that most of the time go all over the body, called systemic therapy is another name for it. And so that can be chemotherapy given through the IV, it could be a pill or other types of treatment like that. With radiation therapy, kind of like surgery, it's a targeted treatment in that we're really trying to focus on a specific area of the body. And so we usually bring people in, they're treated with a large machine, usually called a linear accelerator, that gives radiation treatments using x-rays from the outside. So we don't actually, for most of our treatments, put anything in the patient, usually just delivered from the outside, and they don't have any pain or other problems during the treatment usually.
Okay, yeah, very great explanation to help us sort of understand those different treatment options. In our previous episode when we were here, we talked a lot about personalized cancer care. How does that come into play with what we're discussing here today with radiation oncology, and how is it really different from standard treatment protocols?
That's a great question. So radiation oncology is by design a personalized treatment in that the way radiation is delivered these days, it is designed to be delivered to an individual patient for an individual tumor. These days, the way we target cancer is in 3 dimensions. We design it so that the treatment is sculpted very tightly to a particular area that we want to treat. On top of that, though, with cancer these days, there are so many variables that come into a treatment decision, both in terms of a cancer stage, its size, particular cell type, and then beyond that, there are a lot of factors that are particular to the patient's age, their other health concerns, and also the patient's preference. So when it comes to designing a course of radiation, all those factors are accomplished. Nobody's radiation treatment is the same. So while some of the treatments are somewhat standardized in that for a particular stage we typically do X, within that treatment there is so much personalization that goes into each and every treatment that we deliver that really nobody's treatment is the same.
Yeah, that's really fascinating, and a key reason that seeking care here at St. Joseph's Candler, I'm sure, makes sense for a lot of folks who are facing a diagnosis. Dr. Ramey, let's talk a little bit more, expand on why St. Joseph's Candler is a place that you'd recommend for somebody who is needing radiation oncology.
Yeah, so I think it starts with the people that we have here. I've just felt really blessed to be a part of the team here. We have great people, starting from the front desk staff to our nurses to our therapists who do the radiation treatment every day, to our physicists and dosimetrists who help us design and safely give the treatment. I think we have a great team from top to bottom, and I constantly hear feedback from patients about how lucky they were to have this treatment team, how they really made them feel like family when they came here. So I think that's probably the biggest thing, is just the people that we have here. We're lucky to have a great team to help treat patients here. In addition to that, I think we have here, especially our Bluffton office is our newest location, has a very lovely facility. You walk in the doors and you immediately feel kind of it's designed to make people feel at peace and at home. So I think we're lucky to have the facilities at all of our locations that really make patients feel welcome and feel like they're getting kind of the top service that they can. And then finally, I think we have great technologies to do all of our treatment here. We have very new machines at all of our locations, and so they give us kind of the most modern medicine that we can do for patients in targeting the tumors and being able to give that radiation most accurately and reduce the side effects associated with the treatment. So I think with all of those things, it's just a great place to be able to receive treatment.
A lot of factors that make this a great place. Additionally, we don't have time to expand on it too much in this segment, but clinical trials are available. I understand we've talked to patients in previous episodes who have greatly been impacted by that. So just a great location if you are in the need for care. Dr. Michael will be with us after the break. Later in the show, we'll talk to you again, Dr. Ramey, as well. And thank you for watching. We've got more coming up after this break. We're back here at St. Joseph's Candler's Living Smart in the Lowcountry, of course tackling some tough topics here. Dr. John Michael is back with us. We're going to answer a few questions, some big ones. Thanks again.
Thank you for having me.
Absolutely, it's a treat to be here, but we are talking about some heavy-hitting things. Let's first start about where are we in the fight against cancer, a good way to kick it off for this segment.
Well, thankfully, we're making a lot of progress. Cancer care has evolved to a point where we're focusing not just on actually curing the cancer, but also focusing on patient comfort, patient convenience, and a lot of the main thrusts of research at this point are all focused on those dueling goals of both cure and comfort. And so it's an exciting place to be at the moment. It's an exciting field to work in, because even just in my time out of residency and all, we've seen such vast leaps forward in both the effectiveness and the user friendliness of patient care.
Well, that's one of the exciting things about this particular building and this organization is exactly what you're talking about, the advancements in what you're able to do for patients. What are some of the things that you're optimistic about as you look ahead?
Well, for me, it's the direction of the current research. As we were talking about both comfort and effectiveness of the treatment, we have a lot of clinical trials that we offer in this center that are basically chasing down those goals of maximizing effectiveness while also reducing side effects and long-term toxicities associated with treatment. Some of the major advancements that have come in the last few years have come both from a technological standpoint with the things that we're able to do with radiation, but also on a biological frontier with some of the new medications that have come out that harness things like your own immune system to fight the cancer. Some of those advancements have been real great leaps forward for certain cancer types, and we've seen long-term survivors in scenarios where we used to really see none. And that's been incredibly exciting to see from the standpoint of patient care.
Absolutely. And as we know, the cancer types vary greatly between men and women in some cases. Let's talk a little bit about men specifically in this segment. What are some areas of the body where you're really seeing an increased rate of cancer for males?
Well, when you talk about men, you have to talk about prostate cancer, especially with an aging population, which we have here in the Lowcountry. Thankfully, prostate cancer is one of these great examples of a situation where the care has gotten more effective and more patient-friendly as the years have gone on. Early detection is key. So I would encourage everyone out there to check with their doctor about PSA screening, because the earlier we can catch these things, the better. And when we catch things early, we have a wonderful opportunity to treat them more successfully and more easily, which is all good. Historically, you've had many options available for prostate cancer treatment, starting with surgery, and that too has evolved a lot over the last few decades. But what we do here is radiation for patients that don't want surgery or looking for a non-operative approach. Thankfully, that too has gotten so much better over the years. When I first started out, radiation for prostate cancer, while very effective, was a huge investment in patient time. A typical course of radiation for prostate cancer is usually daily over about 9 weeks, which is a lot to ask of somebody. Thankfully, as the technology has advanced, we've been able to more accurately target the prostate, which has allowed us to deliver the radiation in much shorter time courses. These days, we've now been able to shorten that into just 5 treatments, which we do either over a week or over 2 weeks, but just 5 treatments down from 44, 45, full 9 weeks of treatment. And most patients are generally able to maintain their normal activities during these treatments. Side effects are typically minimal or at least manageable, and usually get better fairly quickly in the aftermath of treatment. And as I said, most people are generally able to maintain their normal lives while they are able to go through these treatments, which are very successful. We're very lucky to have these treatments available here in this center, which is also very important for people to get such advanced care close to their home.
Yeah, absolutely. Well said, and it's exciting to see how many advancements there are in terms of just patient comfort care and the goal, of course, being treatment. So thank you so much. We appreciate it.
Thank you.
Thank you for watching. We'll be back with more Living Smart here in the Lowcountry. We're back now with Dr. Ramey here on Living Smart in the Lowcountry at St. Joseph's Candler, of course, and we're talking about some heavy-hitting topics, but wanted to get you back here to talk to you a little bit more. Thanks for doing that.
Yeah, of course.
So let's talk first about partial breast radiation. Kind of the larger grand scale topic of just what it is and how it's different from what has usually been done to treat breast cancer.
Sure. So traditionally, we've kind of done treatment to the whole breast with radiation. So after surgery, somebody who had a lumpectomy, meaning they just had the lump where the tumor was removed, we would typically do radiation to the whole breast to keep the cancer from coming back. Now, more recently, we've been doing partial breast radiation for certain patients, which is just like it sounds like. Instead of treating the whole breast, we're just treating that area where they did the lumpectomy, plus a little bit of a margin.
So, okay, let's talk more about the advantages there, if you'll expand. Obviously, versus having to treat the whole breast, you're able to target it to the areas you want to treat. Any other advantages?
Yeah, so one of the main ones is potential for decreased side effects with the treatment. By treating a smaller area, we hope that we would decrease the side effects that patients would have with these treatments. And in fact, that's exactly what we've seen on some of the trials that have been done with this. So, anything from less skin reaction to, less risk of, lung inflammation or even heart disease down the road when we're able to treat the part of the breast instead of the whole breast with treatment. So that's the biggest advantage probably. But another advantage is most of these are done with a technique called accelerated partial breast irradiation. So in addition to only being part of the breast being treated, they're done over a shorter time period. So instead of coming Monday through Friday for maybe 4 weeks of treatment with radiation. These are often done over just 5 treatments with radiation, so patients can be done much more quickly with their radiation than they would have been otherwise.
Oh yeah, great advantage there. Let's talk a little bit about disadvantages. Are there any?
Well, so really the only potential disadvantage of the partial breast irradiation, and this could be a big one, is by treating only the part of the breast, we may have an increased risk of the cancer coming back somewhere else in the breast. So that would be the biggest concern with treating part of the breast with radiation.
Okay, yeah, good to know. Let's talk more about the rate of cancer returning. Obviously, a concern for someone who is going through a treatment, when they become successful, is this something I'm going to have to deal with again? So is that different with the partial breast radiation versus another treatment?
Well, so in well-selected patients, so there are National Society guidelines on which patients are most appropriate for receiving partial breast irradiation. So in people who are well-selected in that group, the risk seems very low of the breast cancer returning, whether it's whole breast or partial breast irradiation, so under 5% in either of those groups long-term. So that's the great news. When they did a large trial comparing the difference between the two groups, there was about a 1 in 100 difference in the risk of the cancer coming back at 10 years for the people who got part of the breast treated versus the whole breast treated. So it's a very small difference. And really the authors of the trial said they couldn't say that difference wasn't just due to chance statistically. And so if there is any difference between the two groups in these well-selected patients, it seems to be very, very small.
Yeah, that's helpful to know. Well, it's great to learn about what you all do here, the advancements in treatment for those who are needing to be cared for, as well as some of the clinical trials and other things that you're doing here to really make the patient experience better, more personalized. And thank you for educating our viewers.
Yeah, of course.
Great
Thanks for giving us the chance to come out today and speak with you.
Absolutely, Dr. Ramey. When we return, we're going to hear from a patient and learn a little bit about their experience here at St. Joseph's Candler. We have more Living Smart after this. To round up Living Smart in the Lowcountry today we're going to hear from a patient about their experience here and a little bit about what they went through. We've also got Amanda Thomas who's joining us, talking a little bit about her role. Thank you so much, both of you, for joining us today.
My pleasure.
Thank you. So before we get to talking a little bit about the patient experience, Amanda, tell us a little bit about what it is that you do here for St. Joseph's Candler.
Yes, ma'am. My name is Amanda Thomas. I'm the Director of Radiation Services. So what that means is I basically make sure that patients have everything that they need from the front desk staff once they get referred to us, all the way through treatment and through survivorship.
And what a big role to have, and really making sure everyone knows what they need to be doing. And a big part of your experience here, of course, is staff-wide, as you do touch so many different people throughout the process. This is Dana Settlemyer, and she's here to discuss this a little bit with us. So talk to us about your experience as a patient.
My experience staff-wide was excellent. From the ladies that greet you at the door to every single staff member in every department. They were compassionate. They were professional. The technology, everything about the facility, quite frankly, I felt blessed, truly. I can't say enough about it.
And I heard you even discussing a little bit off camera about, just what a blessing your experience here has been. I'm curious to know a little bit about going through something like this. There's got to be an element of fear, a little bit of that.
Well, my personality ordinarily, usually, is to just address it and find a solution. But I didn't even have to think that far when I got here. I never was afraid. I knew pretty much from the get-go that I was in very good hands. And every step of the way actually was pleasant.
It says a lot.
I don't think people expect that, but that was my experience. It was comforting. I had no problem with it. And all the things you hear, you'd think you would. I had none of that. And they took really good care of me.
Yeah, I
Really
can tell you feel very at home here with your experience. Earlier in the program, we talked to Dr. Ramey and learned a little bit about what some of the treatments look like here. Let's discuss just briefly, your experience with the doctor, and were you able to really express concerns, ask follow-up questions?
Oh, I'm known to ask a lot of questions, and I know enough to not do research on certain websites or any websites. I do question things because I want to be informed, and he was very responsive, again, very professional. Told me every step of the way what to expect, and I got through it.
Yeah, and here you are, and sharing your story with us. We're grateful for that. Before we head back out, we've got about a minute left. I'd love to know what your experience was like with therapists, nurses, in addition to the doctor that you were here with.
I have not one complaint and only praise. As I said, I felt like I became friends with pretty much everyone in every department. It's so comforting, as I've said before, that I think a cancer patient especially needs to feel reassured and comfortable. And every single one of them, I knew that they knew exactly what they were doing, and if I thought that something had changed, I would ask a question and they would explain it to me. And the only complaint I have was the scale.
Well, it's
wrong.
It's gotta be. It's gotta be. Well, you look great. We appreciate
It's a phenomenal
you.
place.
Yeah,
It truly is. I feel like it was divine intervention that I ended up here, and now I can move forward.
Yeah, absolutely. Well, thank you for sharing your story with us today. I know
Thank
it's
you.
a lot to share, and we appreciate you doing that so we can hear a little bit about your experience. Thank you as
pleasure.
well, Amanda, for joining us today. We appreciate it. And thank you. We'll be back after this. Thank you for joining us today. We hope you found this both educational and beneficial. For more information on this program or any of the services provided by St. Joseph's Candler, please visit their website at sjchs.org. We'll see you next time on St. Joseph's Candler's Living Smart in the Lowcountry.